Even with the recent COVID spikes, Hawaii officials tout the state's low numbers compared to the mainland. But Hawaii is among the nation's worst places for racial disparities among COVID victims. Gina Mangieri is always investigating and has details.
I looked at COVID rates by race nationwide, and I found the virus is attacking the Pacific Islander community in Hawaii to an extent unseen just about anywhere else in America by other minority groups. Most states track incidence of COVID by a number of demographics, including age, area of residence, and race. In Hawaii, the percent positive for most racial groups is about the same as their percent of population. But Pacific Islanders show a stark disparity among America's most extreme. At only 4% of Hawaii's population, they account for 25% of the state's COVID cases.
From what we're seeing, it's very similar to what other jurisdictions on the mainland are seeing about their Hispanic population or their African American population. It's just that for us in Hawaii, our Pacific Islander population is that population that experiences a lot more social disparities.
Similar in terms of a minority population bearing the brunt, but far worse in Hawaii than just about anywhere in the country. A KHON2 look at state-by-state racial data found Hawaii's gap for Pacific Islanders is behind only Native Americans in New Mexico, where that group makes up 9% of state residents, but 54% of the COVID cases, and African Americans in Maine and Missouri. It's similar to what University of Hawaii researchers found earlier in the pandemic, too, as they tracked Native Hawaiian and Pacific Islander populations across the country.
Should we get this disease, for example, our Native Hawaiian Pacific Islanders have higher rates of asthma, diabetes, heart disease, and have multiple chronic medical conditions. So should they get this, they're more likely to get severe symptoms, hospitalized, and even death.
Why has COVID spread in the Native and Pacific Islander population so much? In part, many have been on the front lines from day one of the pandemic, while much of the other workforce went home or worked from home.
A lot of the Micronesians are out there, 7-Eleven, and they're out there at the fast food restaurants, they're out there at the nursing homes. We just got to recognize that we're part of this community.
UH estimates about 30 to 35% of the essential workforce, including military, are Native Hawaiian or Pacific Islanders.
So that means they're being exposed to others, but they're also going home to larger households, perhaps where there's multiple people in the house who are essential workers.
The health department agrees congested home settings are contributing to the spread, and both the professor and the health department say quarantine and isolation alternatives are needed.
Maybe having, how they have the hotels for the family members that cannot, be quarantined at home, at least maybe have this more available, like really think of it that we may need this in the next 6 months out.
The nonprofit We Are Oceania has been working directly with the Micronesian and other Pacific Islander communities on cultural adaptations and to reinforce mask wearing, hand washing, social distancing, and putting off gatherings whenever possible.
We learned that some of the ways that the virus was spreading was through funeral services and through church gathering at homes. So we tried to create messaging that would be culturally sensitive, and also, that it's not offending a family member, because those, especially when it comes to funeral, those are a very important part of who we are.
UH and others have formed the Native Hawaiian Pacific Islander COVID-19 Response, Recovery, and Resilience Team, aiming to turn the tide on the disease and build community at the same time.
This is giving me hope that, in this pandemic may shine light to our disparities. However, it also shines lights to our strengths and our assets in our community, and the helping hands that and the culture, the beautiful culture.
The UH Medical School professor tells me access to testing and health care, regardless of insurance, could help combat the COVID disparity, plus the housing alternatives and food security. We'll follow up to watch for progress. Gina Mangieri, KHON2 News, always investigating.